For a year and a half, we have emphasized the symptoms and precautions regarding COVID-19. That emphasis can almost feel like COVID-19 is the only communicable disease that we have to worry about. I want to review some of the guidelines we need you to utilize when you are deciding whether your child is too sick to come to school. Please remember that during school, children are in close contact with each other. If children are kept at home when the first signs of illness appear, it helps prevent the spread of that illness to other children. Your child will recover more quickly if he or she gets plenty of rest and proper care early in the illness. If your child is ill with any of these symptoms, please keep them at home. Nausea, vomiting, and/or diarrhea. Your child should not return to school until 24 hours after the last time they vomited or had diarrhea. Fever. If your child has a fever of 100.4 degrees or higher prior to the start of the school, please keep him or her home to prevent the spread of germs. If your child had a fever overnight or in the morning, please do not give him or her Tylenol and Motrin and then send them to school. You're welcome to give these fever-reducing medicines, but that does not mean the student is not capable of spreading germs. So until that fever is down without the aid of those medications, that time does not start. Students should not return to school until they have been fever-free for 72 hours. Students that are sent home due to fever should remain at home until 72 hours post the last fever without the use of fever-reducing medications. Eye drainage or redness. Do not send your child to school if there is white or yellow drainage from the eye or eyes and/or redness of the eyelid or skin surrounding the eye. This may indicate conjunctivitis, a common infectious eye disease, also known as pink eye. See a licensed healthcare provider if your child has these symptoms. Persistent cough or sore throat. A persistent cough is likely to be disruptive in class. It is also one of the primary ways of spreading a viral infection. If your child has a severe sore throat and a lasting cough, please keep them home until the cough is nearly gone or easily controlled. They may also require testing by your child's doctor for illnesses such as strep throat, which are highly contagious but easily treated with antibiotics. If your child has strep throat, do not send him or her to school until under treatment for 24 hours. Pain, including earaches, stomach aches, headaches, and body aches, often indicate that your child is fighting the flu. This means that they can easily spread the virus to other children, so it's best to keep them home until any pain or discomfort has disappeared. Rash, impetigo, and ringworm, they are allowed in school if the child's under medical treatment and the student allows the site to be covered with clothing or bandages. Fever blisters, any student who has open blisters, mouth sores, and keeps his or her fingers or hands in his or her mouth or puts toys in his or her mouth that are shared by other students should be excluded from school and should not return until the lesions or blisters are dry. Anytime you have a question about whether your child should come to school or not, please call the nurse and discuss. She's happy to take your calls, especially we're kind of operating with more than one set of considerations because most of the things I've just shared with you were true even before COVID, but then there is some overlap between illnesses that are not COVID related, symptoms that are not COVID related, and the ones that we need to watch for signs of COVID-19. The symptoms that are associated with COVID-19 are a fever of 100.4 degrees or greater, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, congested, runny nose, diarrhea. That's such a that there's so many symptoms there that could be something else. That's one of the big reasons why we encourage you to call our Nurse Beth, or Nurse Heather, to discuss how to kind of interpret whether your child can come to school or needs to stay home for a few days, or if we're looking at a situation where it kind of kicks into some of the precautions that we have in place for COVID-19. Students or employees will be excluded from school if they test positive for COVID-19 or exhibit one or more of the symptoms of COVID-19 based on CDC guidance that is not otherwise explained until they present a medical release form signed by their doctor. So what that's kind of saying is all of these symptoms are not created equal. So let our nurse help you figure out kind of where we're at on this list of symptoms, that what your child is kind of showing. And then if Billy has allergies and we say Billy can't come to school because Billy's nose won't stop running and he's sneezing, we look forward to, we appreciate getting a note from a doctor that says Billy's not got COVID. I know that Billy's got allergies. Billy's negative for COVID. Please let Billy return on such and such date. That's great. We look forward to that. That really helps us. Remember that students should remain home until they are symptom-free for 24 hours on most of these symptoms. The COVID ones are a bit different. We have longer wait periods for those, but kind of as parting words, if these kids don't feel well, it's going to be hard for them to come in and be their best selves and do the hard work of learning. I'm not saying every time a kid says they don't feel well that we just automatically let them stay home from school. But you know your kid's best. So if your kid does not feel healthy, please keep those germs at home. Please let your child get some rest, get some fluids, get back to feeling 100%. Thank you.